I'm Dr. Shelly Singh. I'm Senior Consultant, Obstetrics and Gynecology at Rosewalk Healthcare. So today, let me talk to you about mastitis. What is this mastitis? Mastitis is actually an inflammation or an infection of the breast tissue. This is very commonly seen in girls who are lactating. It can also be seen in women who are older, where it is called chronic mastitis, and it is also seen in men. Occasionally, one of the forms of cancer, which is called inflammatory breast cancer, may mimic mastitis. It is also seen in people who are diabetics or who have a low immunity. For instance, if you are on immunosuppressive medication, in case you have AIDS and other conditions which cause immunosuppression. So like I said, it's fairly common in case of girls who are breastfeeding. So let me talk to you about this category of girls who have mastitis. So first of all, let's just talk about the signs and symptoms of mastitis. So like I said, it's an inflammation of the breast tissue. What you're going to feel is that there is going to be pain, there is going to be a swelling which is often wedge-shaped, there's going to be redness, and there is also going to be fever and chills which can occasionally be present. And this will generally be seen because you've just begun breastfeeding your baby. Sometimes there are improper latching techniques, sometimes you're not positioning yourself well. Apart from that, there is also some breast nipple discharge that can happen, and there can also be cracks that are present in the nipple. Why does this mastitis happen? Like I said, sometimes, in the initial journey of breastfeeding, you may not be positioning yourself well when you're feeding your baby, and the latching may not be proper. There can sometimes be incomplete emptying of the breast ducts. There can be clogging of one of the breast ducts with milk or debris, and this can cause an infection. Infection often comes from the baby's mouth itself. It travels down the nipple and these ducts, and therefore it causes a mastitis, which is an inflammation. Also remember that sometimes in older women it can just be because of some debris which are again blocking or clogging these ducts. So what are the signs and symptoms? Like I said, first of all, there is going to be this infection that will be there, so there will be pain. Apart from that, there is also going to be a swelling which is often wedge-shaped, and generally it is on one side of the breast. There will be cracked nipples that may be present, and there will be increased warmth in this area, again a sign of inflammation. So how do you diagnose this condition? Most of the times, you will be able to diagnose the condition yourself. When you notice that there is this kind of pain, there is swelling, etc. that is there, especially in one side of the breast, make sure that you talk to your doctor about this or to your lactation counselor. They will treat it with very simple ways. So how do we actually treat this condition? It's done with the help of antibiotics, it's done with the help of anti-inflammatory agents and painkillers. Apart from that, sometimes it may require hot fomentation just before you're feeding your baby. Cold compresses may also be required after you feed your baby. Remember one thing, it's a very commonly asked question that if there is a problem like this, should I be breastfeeding my baby? Remember, it is always important that you keep on breastfeeding your baby even from the affected side, because more the clogging of this the ducts of the breast, more will be the problem. So we do need to continuously empty out these ducts with the help of breastfeeding. If you're uncomfortable about breastfeeding from this side, make sure that you're at least pumping the milk out. So importantly, like I said, it's basically just antibiotics, and it's going to be painkillers, anti-inflammatories, hot and cold compresses, and also massaging the breast in such a way that the breast ducts get evacuated. So most of the times the good news is that it's a fairly innocuous condition, although it causes a lot of sleepless nights, but it gets treated quite soon. Within a few days or within a couple of weeks, it is going to get relieved. However, in case there is fever or one of the complications develops, which is called a breast abscess, in a breast abscess there is going to be an infection of the breast tissue which is causing a pus discharge which gets collected there. So there is going to be, that then requires a surgical drainage. Otherwise, it's very easy to treat mastitis, and in case it is not treated within a couple of days or within a couple of weeks, remember to meet your doctor. So it is a journey which is a beautiful journey, but then it is also fraught with some problems. Mastitis is one of those problems, but rest assured, in case you have the problem, it's very easily treatable. Happy motherhood, happy breastfeeding.